So good morning. I'm going to do an airway clearance device with an acapella. So the first thing is I'm always going to check the patient's charts before I enter the patient's room. So after I got done with the patient's charts, I would always come in and introduce myself to the patient and check their ID band. So once I'm done with that, then I'd wash my hands, dry my hands, apply the appropriate PPE, just put some gloves on. That way if they have any secretions or anything, when I do this treatment, then that way I don't get anything on my hands. So the first thing is I'm gonna listen to the patient's lungs, auscultate them, see if their lungs sound coarse, if I hear any rhonchi, anything like that, and then place down the vital signs before the procedure. So today here I have an acapella. So this here, you want to set it at the lowest setting, so the lowest resistance. So I'm going to turn it all the way down just to start the patient off to see how it feels for them. And if they can't, especially for an elderly patient, they may not be able to get their full expiratory rate out just because of the fluttering that it causes the lungs to do. You may not be able to get the force out for the patient. All right, so what I'm going to do for the patient, I'm going to instruct them on how to perform it first, and then I can do it along with them, just kind of talk them through it. That way they get the appropriate thing with this, okay? All right, so here I have an acapella. So here, this is how I'm going to have you do this, okay? I have it at the lowest setting to start you out with, just that way we work your way up. That way you kind of get a feel for what it's going to feel like, and then we'll see how high you can go. And we'll continue to do these exercises, especially after you have any treatments with a nebulizer or anything like that. That way we can get you to cough up some secretions and clear out those lungs so you can breathe better. So what you can do is you're going to hold it with your hand, and I'm going to have the patient, like I can have them have their bedside table there, and I can have they need to have their elbows on the table when they do it. So you can hold this like a microphone, okay? So what you're going to do is I'm going to have you take a regular breath in for 1 second, and then I'm going to have you exhale nice and strong, but not forcefully, okay? So I'm going to have you breathe in, and then exhale, okay? So we're going to do that, and even though it flutters, try to continue to breathe out until you get that full expiratory rate out, because it will help you cough up any secretions you may have. All right, so I'm going to put this up to your mouth, and you're going to have you breathe in, and then exhale. So when we do this, I'm going to have you do it 4 to 8 times for 10 to 20 minutes. And if you ever feel lightheaded, we don't have to do that many. We can just spread it out until you feel comfortable and get your lungs strengthened up to be able to cough up any secretions. So when you do this, you never want to cover the end piece here. You want to always leave that open, or else it's not going to flutter like it's supposed to. You're not going to get that flow through there. And then when we go, then we can slowly raise it up for when the patient can go up. That way we can continue to work their lungs and get their lungs strong and be able to cough up anything. All right, so when we are done with this, we can put it in an appropriate bag. So they can take this home with them. This is a little device that they can take home with them and to be able to practice and get their secretions going out of their lungs. That way they can cough it up. And we can put their patient's name there. So when we're done, we can place it in there, into the bag. Now, if they cough up anything, we need to chart anything like what the color was, how thick it was, if there's an odor to the sputum or anything that they had coughed up. Make sure we document what they have coughed up. And if they need a sample, we can give them a little device, a little cup, that way they can cough it up, and then we can give that to the doctor too. So when I'm done, I'd remove any gloves, anything like that, wash my hands, and reapply my gloves, and reassess the patient. I would get their vital signs, and then I listen to their lung sounds to see if the acapella was working properly for the patient, and then I go and chart it on the patient's charts and let the doctor know that I did an acapella treatment with them.